Hello and welcome everyone. I'm Dr. Val Nkendong, a psychiatric mental health nurse practitioner. Today's video is crucial for anyone interested in mental health, particularly in understanding and developing a mental health crisis safety plan. Please note, this video is intended for educational purposes only and is not a substitute for professional medical advice. Now, let's delve into what a mental health crisis safety plan is and its importance in managing mental health crises effectively. A mental health crisis safety plan is a proactive, personalized plan created to guide individuals through periods of mental health crises. It's a series of steps tailored to help an individual recognize early warning signs and implement strategies to prevent a crisis from escalating. This plan is essential not just for individuals with a known mental health condition, but also for their caregivers and mental health professionals. It serves as a vital tool in reducing harm, providing immediate and effective interventions, and guiding the individual towards recovery and appropriate support. Let's break down the key components of an effective crisis safety plan. 1. Identification of warning signs. Think of this like a weather forecast for mental health. Just as a meteorologist identifies early signs of a storm, in a crisis safety plan, we identify early signs of a mental health crisis. These could be specific thoughts, mood changes, or behaviors. Recognizing these signs early is like catching a small leak before it becomes a flood. It's about noticing the small changes before they lead to a bigger crisis. 2. Coping strategies. These are personalized tools or actions that someone can also manage symptoms when they first appear. Imagine having a toolkit where each tool serves a specific purpose. Coping strategies work similarly. They might include activities like deep breathing, exercise, engaging in a hobby, or using relaxation techniques. The key here is personalization. What works for one person might not work for another. It's like having a custom-made suit. It fits just right for the individual's needs. 3. Social settings and contacts. This involves identifying safe places and supportive people. Safe places could be any environment where the individual feels secure and at ease, like a particular room in their home or a park. Supportive people are those trusted individuals, friends, family members, or mental health professionals who can offer help or a listening ear when needed. It's like having a safety net of people and places that you can fall back on when things get tough. 4. Professional help. These are specific steps on how to seek professional help and include essential contact information for immediate access to mental health services. It's like having a map and compass that guide you to the right help at the right time. These could include phone numbers of therapists, crisis hotlines, or local emergency services. It ensures that in times of crisis, the individual knows exactly where to turn for professional support. 5. Making the environment safe. This step is about reducing access to means of self-harm or suicide. It's similar to child-proofing a house, but in this case, it's for mental health safety. It might involve removing or securing potentially dangerous items like firearms or medications. The goal is to create a safe physical space that reduces the risk of harm during a crisis. Let's talk about the difference between a written commitment and a safety contract. Many people confuse a crisis safety plan with a written commitment and safety contract, but there's a significant difference. A written commitment to the safety plan and its steps is like signing a contract with oneself. It's a physical reminder of the individual's dedication to following the plan. This could be a signed document, a note on the fridge, or a reminder in a phone, something tangible that reaffirms the person's commitment to their safety and well-being. It's not just a piece of paper, it's a powerful statement of intent and a constant reminder of the support and strategies in place. A safety contract is usually a promise made by the patient to their therapist or doctor that they won't harm themselves. It's more like a handshake agreement. On the other hand, a crisis safety plan is more of a detailed strategy. It includes steps like identifying warning signs, having a list of people to contact in crisis, and removing harmful objects from the environment. It's a proactive, comprehensive plan, more like a detailed instruction manual for staying safe rather than just a promise. It's crucial to understand when a crisis safety plan becomes necessary. Imagine someone who has faced mental health challenges before. They might be more vulnerable to future crises. It's similar to having a first aid kit ready before an injury happens. Also, consider someone who has just left a psychiatric hospital. They are stepping back into their daily life, which can be overwhelming. A crisis safety plan is like a roadmap for them, guiding them on what to do if things start to get tough again. And for individuals identified as at higher risk for a crisis, this plan acts as a preventative measure. It's not just about reacting when things go wrong, it's about being prepared and proactive, which can significantly reduce the risk of a crisis. To understand how a crisis safety plan integrates with suicide risk assessments, let's take a closer look at something called the Columbia Suicide Severity Rating Scale. This tool is like a detailed questionnaire used by mental health professionals to determine how at risk someone is for suicide. It asks about things like whether the person has thought about suicide, if they have a plan, or if they've ever attempted suicide. By using this scale, professionals can gauge the level of risk. Then, they tailor the crisis safety plan to address these specific risks. It's like customizing a safety net, ensuring it's strong and wide enough to catch the person if they fall. Let's make this more relatable with some real-life scenarios. Imagine someone with a history of severe depression. Their safety plan might include recognizing early signs like withdrawing from friends or feeling hopeless. It might suggest activities that help them feel better, like going for a walk or calling a friend. The plan also includes emergency contacts and professional help if needed. Another scenario could involve someone with anxiety. Their plan might focus on breathing exercises or identifying when to step away from stressful situations. Each plan is tailored to the individual's specific needs and circumstances. Think of it like a personalized guide to navigating through tough mental health challenges. To conclude, a well-prepared mental health crisis safety plan is more than just a document. It's a potentially life-saving tool and an essential component of effective mental health management. It's important to create and regularly update this plan with the guidance of a mental health professional. Thank you for watching, and if you found this video helpful, please subscribe for more informative content on mental health. Remember, taking care of your mental health is crucial, and having a plan in place can make all the difference.